The Integrative Medical Institute of Orange County is dedicated to the well-being and health of each patient that enters our doors. Our program seeks to restore and maintain health and wellness across a person's lifespan by understanding each patient's unique set of circumstances and addressing the full range of physical, emotional, mental, social, spiritual, and environmental influences affecting their health. Through customized personal care, we go beyond the treatment of symptoms to address the underlying causes of an illness. Our multidisciplinary, multimodal healthcare providers have worked together as a team for years. Through this, we are able to facilitate the body's innate healing process, no matter what the symptoms or difficulties each patient may present. Our approach is integrative. We partner with each of our patients and consider all factors of health, wellness, and disease while taking into consideration the body, mind, and spirit connections. We, as a team, partner, collaborate, support, and share the clinical management of each patient. From the point of entry through the treatment process and with routine follow-ups, we provide an integrative approach to healthcare and wellness.
My name is Gary Ruelis. I'm a physician and a clinical neuropsychologist. And my PhD is in clinical child neuropsychology, and my medical degree is in osteopathic medicine. Did a residency in family medicine and postgraduate work in integrative medicine.
My name is Dr. Richard Landis. I'm the clinical director here. I'm a clinical psychologist, and my doctorate comes from USC. I've got postdoctoral degrees in psychopharmacology, traumatology, certification in pain management.
My name is Viviana Shelp. I'm a licensed clinical social worker, a licensed psychotherapist, and I have a private practice here. Like a lot of us, we work together, but privately in our practice.
I'm Vanessa Hernandez, and I'm a licensed marriage and family therapist.
My name is Donna Kroll, and I'm a licensed clinical social worker and a licensed psychotherapist. I received my graduate degree from UCLA.
I'm Aylin Lightbody. I'm the front office manager as well as the neurofeedback specialist here at IMI.
As a staff, we've been together for a number of years, so we have a very united, cohesive relationship that we've developed over the years because we're all colleagues and we all have a similar model, though each and every one of our staff brings a different expertise. And we have been able to use our relationships to really enhance a community of healthcare that is not only an integrative form of care, but our care and our relationships are integrated.
Integrative medicine, to me, is the belief that the body and the mind has the power to heal itself.
We're not only looking at the biological side of things, but also the psychological and emotional side as well, and that helps us treat the body as a whole.
It's mind and it's body and it's spirit, and we all have a part of that here at IMI.
Whatever works the best. Certain things work really well on this, other things might work really well on that. We might refer for acupuncture in one area, but for something else, we might be doing electromedicine like the alpha stim.
We have the yoga instructor. We have Dr. Ruelis, who looks at even deeper physical issues as well as emotional issues.
My general philosophy is that nobody's really sick, so they don't need to be cured in terms of psychology. That they're not broken, they don't need to be fixed. That most people have everything they've got that they need inside of them. They're just not aware that they have it. Or there's certain information that they're missing in knowing how to use it.
My general focus in therapy is really to think about the person and how they view themselves and their experiences. So when they come, I listen very closely to how they are thinking about themselves and how that self-identification fits into the world around them.
I see clients come in and they're often disengaged or disconnected from others. They're blocked in their personal growth. And so I use a variety of tools to help engage with them and help facilitate change. And some of those tools I utilize are mindfulness, cognitive behavioral therapy. We sometimes do some energy psychology with tapping. I utilize meditation and hypnosis, and sometimes systems work, bringing in their family members, all in attempts to help clients uncover what they need to heal themselves.
For me, working with children, I utilize a lot of play therapy, play being the universal language of children. But I also am EMDR certified, and I have advanced training in cognitive behavioral therapies, and can also work with clients that want to do longer term insight-oriented type therapies as well.
We have moved from the model of a disease-oriented, evidence-based program to one of correcting deficiencies and imbalances, where our practices in the business of transforming health. We were looking at enhancing optimal levels of care by correcting deficiencies that lie in the body, minimizing its potential. We study molecular structures. We correct those pathways for the individuals to restore their health, moving away from just managing diseases. In pre-med medicine, we study cell biology and biochemistry. We study all these pathways. When we get into medical school, we start looking at diseases and medications. Doctors, far more brilliant than I, decided to go back to these initial pathways that were not taught in medical school. The science has gone from just evaluating a particular level for patients of their deficiencies or their nutrients or antioxidants or minerals to now that we can study the integrity of the cell membrane, to actually looking at organelles inside the cell and measuring ATP production of the mitochondria. And these results are not inferred. There are actually mechanisms in which we can actually study these productions, which is really a transforming time for medicine, that we can actually look at these things, measure them, and know how to correct them. So for us, it's a very, very exciting time in looking at the changes that we're able to make with the patients that come to see us, whether they're 6 years old or they're 75 years old. The changes can really be made significantly in their lives. It's changing now, but typically patients that would come to see doctors such as myself were really, the majority of them were kind of a last-ditch effort. They had tried other forms of care, they weren't responding, and so we were seeing the most difficult cases that were not responding to traditional forms of medicine. And so people were very desperate. And so they were looking for, cures, and we would say, look, this is going to take some time. We're in the process of restoring health, but we can't guarantee any kind of outcome. The other category of patients, and it's really changing now, but back initially were people who would come in with a lot of psychological distress. So we would actually begin to treat both psychological and physical difficulties under one plan with the providers here. Now we're seeing more and more patients come in for preventive care. They really have learned a lot more of what we can do, and they come in before they begin to have symptoms, are looking at ways of restoring their health, getting more energy. The range of patients that we see we have patients who come with fourth-stage metastatic cancer who are looking at ways of prolonging the quality of their life, to people with diabetes or hypertension, to children with learning disabilities or autism or pervasive developmental disorders. And the approach is pretty much the same. We will study their levels of deficiencies. We'll study their levels of poor metabolism, poor energy production, and begin to provide a plan that's individualized for their levels and what their studies reveal, and begin to change that for them.
Through our neurofeedback program here, we usually start with running the brain mapping, or QEEG. So that's where we actually hook the patients up to a cap and we're able to read the brain waves live. After we've run the QEEG brain mapping, it will create a report for us to analyze all the brain waves. So it'll let us know if there's any abnormalities in alpha, beta, theta, high beta, or delta waves. We can then create a personalized treatment plan for you, which we use in the neurofeedback process. We're actually able in our neurofeedback department to treat pediatric, adult, and even the elderly patients. With the pediatric patients, it's more the learning, behavioral, and emotional disorders that we'll see more often. With the adult patients, we actually see a lot for sports performance and brain optimization for sports enhancement. So we see some professional athletes as well. For the elderly, we're actually able to work on the neurofeedback for memory as well as hearing loss. So even just the slight changes and tweaks in the protocol can help enhance that.
The integrative approach of yoga with this type of therapy and healing session would be using different types of yoga postures to help relieve stress from the body, to relieve any tension that might also be there. We also use meditation, which is basically just a way to clear the mind and bring about clarity in general. We also use some breathing techniques, and I'm a big fan of hands-on massage too. So.
My name is Dana Luciani, and I am the registered nurse here. Some of my responsibilities are the micronutrient IV infusions, blood draws. Part of my responsibility is talking with the patient, making them comfortable while they're having their IV infusions. We also provide a treatment called microcurrent treatment, which is also something that I do. So the microcurrent treatment is used to treat pain and also shingles, promote healing after post-surgical procedures or sports injuries or accidents. And it sends a light current throughout the body that helps stimulate healing.
I always invite people to explore, and I think the more resources somebody has, the better. So I think it's always worth it to come in, get an idea about the services anywhere, make sure it fits for you, that you're comfortable, and that whatever practitioners you choose for your treatment share the same value system that you do in terms of what you want out of your treatment.
Well, the goal with every patient is obviously better. You know, the goal is not perfect. The goal is not never to have anxiety, never to have depression again. The goal is to manage and feel better. So when someone comes in, we want to make those goals realistic. We want to say, you know, there is no such thing as a life without feeling ups and downs. But understanding them and managing them is what these tools are built for. And so my approach, I think, is very practical in that we're going to have these stressors. Some of them are going to feel overwhelming. What do we do when that happens?
They don't have to have all the answers. They don't even have to know exactly why they want to come in. It's just a process to get started, and we'll help them through that process. To come, to check us out, to spend some time with us. Once people start sharing their pain or their trauma, they feel better.
If I had a new patient come in and say, okay, what is this about? I'm a little anxious about coming in. I'd say, look, there are a couple of things that are very important in life. Connection is where health lies. Whether it's the organs in the body connecting to each other appropriately, or whether it's interpersonal and how we connect with each other. That integration and that balance becomes everything in life. In the biological system, those connections can be enhanced by making sure that everything that is in there, that should be in there, is in there. that there's not imbalances or deficiencies. And so that's one part of the biological connections that we look at, and that include, as I mentioned before, nutrients, antioxidants, minerals, hormones, food, removing things that might be toxins that could impinge on the connections. And that's one form. And when that connection is running right and the brain is enhanced, then the other part of the connection also becomes important, and that's the interpersonal connection. And that connection, whatever word you want to use, I think about it as a continuum, is love. How we are connected to each other to different degrees, and our ability to manage that. And that's an unconditional process, and that's what we seek. That's what we long for. All disorders in the DSM-5 are really descriptions of difficulty with connections, whether it's psychosis and somebody is totally disconnected from the world, or it's depression because they feel a loss of connection, or anxiety for the fear of connection. But all those factors are disorders of connection, and how we manage that, or how we manage separation. And then there's the head, which I think is accumulation of all our memories and thoughts and beliefs and structures, and really a lot of our fears come from our head. And so we are trying to find that balance too. How do we let go of that that's impinging on us? Our fears are our mental toxins, as heavy metals might be biological toxins. And so I'd say, come in and let us begin to look at how to enhance those connections for you. And the way that we do that is to potentiate your own ability. We're not going to create it. We're just going to enhance your life by working with what you have or what you don't have, and helping you build that. And it's a very, very safe, easy process, but it'll be very unique to you.